Hi, I'm Buzz Tabatchnick. I'll be 72 this June.
My name is Meryl Tabatchnick. I am married to Bruce Buzz Tabatchnick, who you just met, and we live in Fort Lauderdale. My husband was diagnosed with prostate cancer in June of 2016.
I took regular checkups, and one time the doctor told me my PSA looked out of bounds. I went to the urologist, and he confirmed that, and then the biopsy, which was no fun at all, I can tell you that. He came back and told me I was a 9 on the Gleason scale. The higher the number, the worse it is, I guess. And I don't know if there's a number above 9. I said, okay, what are my options? And he gave me a couple options, but the direct line was take the prostate out. So we asked him where, when, how. He said, if you don't want to have any regrets or any second guesses about the aftermath of surgery, you have to go to Dr. Patel. 9 was enough that Dr. Patel's office kind of gave us what I refer to as pre-boarding. Said, we're going as soon as possible. My pre-surgery consult, it was really with an entire group of people. Everyone has a unique specialty. Everyone makes you feel like they're happy to see you. It's just a comfort level of feeling that we're in good hands.
I knew Dr. Patel was the right man. He was kind, he was calm, he looked us in the eye. I just knew it was the right place to be. There was not one doubt in my mind. We were able to have the surgery scheduled. We arrived here in Celebration.
And then I woke up on the other side. And I realized how well I was being treated. Couldn't figure out why, because I'm not that important of a person. And then on the wall in front of me, above Patel's name, it said VIP. So I said to my wife, now I know why. They marked me as a VIP. And then she looked at me in a way that she does look at me and told me that I'm not that smart, that was Dr. Patel's first name. And that's how everybody gets treated.
I've had lower back pain on and off for about 5 years. I went to my orthopedic, who said it's time for an MRI. He did an MRI, and he said, you have something on your kidney. You definitely need surgery. So that shocked me, that upset me. Out of nowhere, I said to my husband, what about Dr. Patel? Do you think he does surgery on women? And I called, and unbelievably, Alina, who I had spoken to 2.5 years previously, answered the phone. And I asked her if Dr. Patel sees women, and she said yes. Does he do surgery on kidneys? And she said yes, and made the appointment. All of my fears and anxiety left as soon as I knew Dr. Patel was going to take care of me. The morning that I arrived at AdventHealth for my surgery, I was greeted by the same concierge that greeted us when my husband had his surgery over 2 years before.
Coming back and seeing the same faces and the same people, the team is still intact. That's a tribute, and I kind of feel tangentially a little bit part of it. Maybe I'm just a fan, but I feel like part of the team. And of course, the outcome was as expected, was terrific.
Same kind of care, incredible, outstanding care. After the surgery, of course, he did the biopsy, and the small tumor was benign. To me, that was a miracle. It was mentioned that we are the first husband and wife that Dr. Patel has ever treated. We felt so honored and so excited that we were a first.
We look at these type of things in our life as a good fortune, a good opportunity to meet great people who do great things for so many people. It's something that we would not have had an opportunity to do if I was not diagnosed with prostate cancer. Being able to share that experience with people, or maybe it's to encourage people to get tested, or people who do get tested to consider surgery, or people who think that they have an uphill battle or have been dealt a bad hand. It's just the opposite is true. Getting diagnosed with prostate cancer and getting through it is great opportunity to get better and a great experience to share with people.